Hello guys, good morning. Welcome back to my YouTube channel. This is Miss Henderson. I hope you having an amazing day and happy new year to all my subscribers that has been subscribing to my YouTube channel. So today I have a few questions on my laptop on Prometric Cna practice test questions. So what I'm going to do, I'm going to be just reading some of these questions for you, and I hope it can help you to pass your Prometric exam. So that being said, I'm going to read the first question to you. So the first question is, when assisting a client in in learning how to use a cane, the nurse's aid stands approximately 2. So guys, where should the nurse's aid stand when assisting a client to stand or ambulate? So is it approximately 2 feet directly behind the client? No, that's not correct. B, about 1 foot from the client's weak side? No. C, about 1 foot from the client's strong side? D, slightly behind the client on the client's weak side? Yes, absolutely correct. D is the correct answer. Stand slightly behind the client on the client weak side, because we have to support the patient on their weak side. So D is the correct answer for this question. So guys, let's look at question number 2. Question number 2 states, when working with a client who has urinary retention, the nurse's aide can expect that the client will A, urinate large volumes, B, be unable to urinate, C, urinate frequently, D, be incontinent of urine. So when a patient has urinary incontinence or urinary retention, actually, they're unable to void, they're unable to urinate. Oftentimes, the doctor or the nurses have to insert a Foley catheter. So the answer is that the patient is unable to urinate for question number 2. Bear in mind these questions. So question number 3, let's look at question number 3, guys. Aging related to hearing changes result in older client gradually losing their ability to hear? A, high pitch sound, B, low pitch sound, C, sound level, D, faint sound. So the correct answer for this question is A, high pitch sound. A lot of times the aging process results in patient is unable to hear high pitched sounds, and a lot of times they have to wear a hearing aid. And part of our job as a CNA or a home health aide is to make sure the hearing aid is placed appropriately into the patient's ear. So question number 4. The best way to safely identify your patient is by A, asking his name, B, calling his name and waiting for his respond, C, checking the bed plate, D, checking the name tag. So what do you think is the best way when you're working as a CNA to identify a client? So the correct answer is checking the name tag. Normally, I as a nurse educator always tell my CNA students, make sure you check the name tag. Also, you have to check, it's two verification, name tag, and also ask the client to verify. Question number 5. A client is on a bowel and bladder training program and has not had a bowel movement in 3 days. The nurse's aide should, now this is a priority question, what would you do? Report it to the charge nurse. B, give the client an enema. C, offer the client prone juice. D, encourage the client to drink more fluids. So guys, what would you do? What is within your scope of practice as a CNA if your patient didn't had a bowel movements for like 3 days? Is to report to your charge nurse. So reporting to the charge nurse is within your scope of practice, and that's what you're supposed to do if your patient didn't had a bowel movement. Let's look at question number 6, guy. The proper medical abbreviation for before is A, PC, B, BID, C, AC, D, TID. PC is after meal. BID is twice a day. And C is before meals. And TID is 3 times a day. So the correct answer for question number 6 will be C, as in Charlie. Question number 7. A client is diagnosed with hypertension will most likely have a history of what? Low blood pressure, high blood pressure, low blood sugar, high blood sugar. The correct answer is high blood pressure. High blood pressure is the correct answer. Question number 8. A patient who has difficulty chewing or swallowing will need what type of diet? So, is it a clear liquid? Is it B, low residue? C, puree? D, mechanical soft? So clear liquid diet, that's out, because that's normally recommended for people that is going for like a colonoscopy or on surgery list. So the correct answer for this question is D, mechanical soft. That will be the correct answer for question number 8. So now let's look at question number 9. An elderly resident with Alzheimer's disease cannot find her room. Question number 9. An elderly resident with Alzheimer's disease cannot find her room. How can the nurse's aide help the client feel more independent? So, this is a confused patient and is unable to find a room. A, tell her to stay in her room. B, have her roommate secretly watch her. C, place a familiar object on the client's door. D, write the room number on a piece of paper. So the correct answer is to place a familiar object on the client's door. That way, the confused patient can recognize her room. So C is the correct answer. And guys, you can expect to find these questions on Prometric exams. So I strongly suggest that. Question number 10. How often should a patient's intake and output be recorded? Once a shift. B, twice a day. C, every 4 hours. D, every 12 hours. So how often should you record the intake and output on a patient's chart? It's once a day. A is the correct answer for question number 10. So guys, this is it for this video. I just had a few questions, 10 questions on this video. Please consider subscribing to my YouTube channel. Please like and share these videos, and please drop your comments below. Thank you for watching, and I will catch you in my next video. Please continue to read your textbook, and please continue to share these videos.